Okay, series number 1 on shock. So a lot of people, when they think about shock, they think about people bleeding to death, and it's true, it's one of them. But there's 4 of them, and actually each one of them can be applied to trauma. And a lot of time people don't think about those other ones, and in sometimes it's a limited thinking because they don't know about all the pathology that it goes in between it. And also, one of the first thing is because a lot of times it's the definition of shock they don't understand. So a lot of time people define shock as a low blood pressure, but that's not what it is. The real definition of shock is a poor oxygen delivery to your cells. That's what a shock is. That means the cell that has the little truck that has oxygen on it is not making up to your cell appropriately, and therefore you're in shock. So there's 4 different type of shock. There's the hypovolemic shock, which we mentioned in the first video, which was that. So that means that you don't have enough volume. So that means that little truck with the oxygen on it doesn't have enough medium to make it to a certain place, and then your body start to shut down. So meaning that it start constricting some of his vessels to keep so for example, your hands and your side, and we'll see why I'm starting to talk about the extremities, can become important, because it says I don't need my hands, but I need the head, the heart, the lungs. And so it will start keeping all the blood going to your main organs, and so it'll shut down peripherally and go centrally until it cannot do that. And even your kidneys, I don't need the kidneys if I don't have the heart and the brain, so shut the kidneys. So they'll start seeing some, and this is the sign and symptoms that we see in severe shock. So that's one thing they'll do. The other one is called a distributive shock, and what happens is that it's a little bit the opposite. Is that you have fluids, but what happens is that the amount of fluid that you have, instead of living in a space like this, it goes in a space like that. And so what happens is that vessels dilate, so they become much bigger, and so the same amount of fluid that you have has to take too much of a big space, and then basically your blood pressure goes down again because there's not enough pressure that hits the walls of your blood pressure of your vessels when you listen to it. So what has to do with trauma? Well, there's different kinds, but one of them that mostly, and a lot of people will call it like that, but they call neurogenic shock or spinal shock. And so basically, if you have an injury to your spine, what can happen is that constriction, dilatation of your vessels can be affected. And so basically, somebody has a bad injury to his spine could dilate his vessels, and basically now you can have this other cause, but one of them could be the cause. So in trauma you could have that as well. So you see that even now, if I try to give too much fluids to this person, it's not just that. It's not just controlling the bleeding. There could be another cause of why they're what I'm looking at. The third one, it's called the cardiogenic shock. And so that means is basically the pump doesn't work very well, because how our blood circulates is pretty easy. So basically there's liquid that comes to the heart, what we call preload. So it preloads the heart, then the heart squeezes it, and this is called contractility. So how hard the heart pumps, contracted, and then it goes out. And the vessels, this is what we call the afterload, is how much they're pinched. And so you can imagine that if I don't have a lot of fluid to a heart that is contracting very hard against something that is very pinched, it will have a hard time circulating this stuff. So each thing can be. So in a cardiogenic shock is the pump himself. So the heart doesn't control well enough to push the blood out. And there is condition that can happen in a trauma. For example, you can have a contusion on your heart. It could have, like, because as your chest hit the steering wheel, the heart could just go in and have a bruise, just like you have a bruise on your heart, on your arm or your leg or something like that. It can happen because the heart is a muscle, so it can bruise. And then because that part doesn't work well, because it's affected, you could have cardiogenic shock. They're pretty rare, but it could happen. The other one that is a little bit more common is a constrictive shock. And a constrictive shock is that you have now this pump that tries to get out the liquid. The vessels are pretty good, but what happened is that in the heart himself, it cannot push the heart. And there's two conditions mostly related to trauma that this can happen. The first one is what we call a pneumothorax, but not the usual one with the holes and everything, but an attention pneumothorax, meaning that the air accumulates inside the body. It creates a pressure so big in the thorax that the heart, when it tries to push the blood out, it has to constrict against the pressure that is too strong inside built it in the chest, and so basically it cannot go out. So the treatment for that wouldn't be to give more fluids, but would be to decompress the chest, which sometimes we do. And if you ever did a advanced first aid course, then you would learn about that. The other way that it could also happen in constrictive of the heart is that blood could accumulate between the layers, and so the heart muscle is in a little sac. And sometime, by when we're saying, if you hit your heart on if your heart hits, let's say, the steering, so your chest hit the steering wheel and the heart goes inside, vessels break down and accumulate inside, and this is called a tamponade. And what happened is that the heart, the sac becomes so filled with blood that it constricts that muscle that is trying to get up, and no blood can come out. So this is an emergency, obviously, and that one is a little bit harder than just putting a needle. It is putting a needle, but you have to know exactly where, and you have to have like special tools for that, and even sometimes you have to open the chest to go in and relieve. So not something that you can do really in the field. But the decompression of the chest, that one is so. As you can see, a lot of the time people talk about shock in general, they'll talk about bleeding and losing fluid, and that's why we need to start an IV and give fluids to every trauma patient and stuff. But there is other cause of shock than just that one of hypovolemia. There's all those other causes, and you need to know the treatment for each one of them. So I just wanted to do a quick intro on shocks and talk about it. And I mean, this some people, they study that like almost their whole life, and it's a very hard concept, but I wanted to give just a little quick approach on the different type of shock and the trauma, and encourage you to read and follow up, and if you have more questions, read about that. In the second part, what we'll talk about is the signs and symptoms facing those things that we can see, and why sometimes just taking the blood pressure may not help me. And there's other signs that we can do, and something that you can carry that is very small, that you can carry in a blowout kit that could be much more effective than the blood pressure cuff. So we'll talk to you soon.